The gentleman from Maryland is now recognized.
Thank you, Mr. Speaker, and thank you, Mr. Chairman, and thank you, Madam Ranking Member, for the work that you have done and the Chairman have done together and your committee to bring this bipartisan, very important bill to the floor. I want to thank them both for their hard work and the committee for its hard work in compiling this bipartisan package to combat two of the most important issues, Mr. Speaker, facing communities today: mental health and drug addiction. The COVID-19 pandemic exacerbated mental health and addiction challenges that were already present, of course, in our communities. For those already experiencing severe depression, anxiety, or even substance abuse and addiction disorders, the pandemic made it harder to access mental health care and essential help and resources, and created, of course, much greater anxiety. This bill would reauthorize key mental health and addiction programs while helping to strengthen communities' crisis response. There are many important programs included, but I will highlight just a few, Mr. Speaker. Among them is legislation from my friend David Trone to help states expand the availability of high-quality recovery housing as they receive treatment from substance abuse. Representative Trone has been a leader on this issue as co-chair of the Bipartisan Addiction and Mental Health Task Force. Also included, Mr. Speaker, in this legislation is legislation from my friends Cindy Axne and Chris Pappas to revise opioid treatment program criteria to help those in need of treatment access it more quickly. Our in-house pediatrician, Representative Kim Schreier, authored a provision to help children and teens who have had their lives upended by the pandemic access the mental health care and services that they so badly need. Mr. Speaker, I'll also mention a critical section added by Representative Susie Lee to provide important resources for virtual peer support programs. Representative Lee knows how much her constituents have benefited from these types of programs and how much more good they can do if given the proper resources. And Representative Tonko from New York included legislation to expand access to prescription medications that help patients overcome addiction disorders. Mr. Speaker, these are just a few of the very beneficial policies included in this legislation that will improve lives and indeed save lives. I'm so proud of the Energy and Commerce Committee and all of the members whose legislation is included in this bipartisan package, which demonstrates how we can join together, Democrats and Republicans, to pass important legislation and show those we serve they are not alone in facing these challenges. Mr. Speaker, I hope this strong vote today will help move these critical policies through the Senate and see them quickly enacted into law. And I urge a yes vote and yield back the balance of my time.
The gentleman from